Very good morning to all of you. Today we are going to discuss about the essential medicines list. We shall be discussing this topic under the following headings. That is essential medicines concept, which you will be just learning the definition of this, the definition of essential medicines, the essential medicine list, the various aspects of it you will be learning, that is types, criteria for inclusion of a drug into the essential medicine list, criteria for deletion of a drug from the essential medicine list, the advantages and weakness of essential medicine list. So this is more or less a very theoretical topic, and there's a lot of written stuff in this, but the core area which you have to mainly concentrate as an undergraduate student, or which is important from your examination point of view, is the definition of essential medicines and principally the criteria for inclusion and deletion of a drug from the essential medicine list. These are the two aspects which you will be mainly concentrating during the session today. So what is this essential medicine concept? This is using a limited range of carefully selected essential medicines leads to better healthcare, better drug management, and lower cost. So this sentence must be clear to all of you, that it means that if we use a limited range of medicines which we have selected very carefully, this will lead to better healthcare, better drug management, and lower costs. So why do we require such a concept? This is because there is indiscriminate marketing of drugs in the world. So you know that every now and then new drugs come into the market, but all these drugs may not be catering to the majority of the people. They may be just an additional drug and may not be having any special advantage over a drug which is already available. There must be drugs which are just catering to some people. Okay, so there's a lot of drugs which are coming into the market very often. For Hence, for optimum utilization of the resources which the government has, the government should concentrate on including the drugs which are catering to the majority of the population as essential medicines, and this will lead to better health outcome. Okay, this is why we require an essential medicine concept. So we can get over the indiscriminate marketing. We can just have a list of essential medicines which will be catering to the majority of the population in the world. Now, what is the definition of essential medicines? So, the medicines that satisfy the priority healthcare needs of a population are called as the essential medicines. This is a WHO definition. Now, the selection of essential medicines is based on public health relevance, evidence on safety and efficacy, and comparative cost effectiveness. This I'll explain further with some examples. So at this point, you have to remember the definition of essential medicines. These are the medicines that satisfy the priority healthcare needs of a population. Now, we'll see what are the criteria for calling a drug as the essential medicine. So, as I told you, they should be based on the public health relevance. So that means the medicine that we are considering or going to name as the essential medicine should cater to a large population. That means it should be applicable or should be used for a disease that is highly prevalent or is emerging in the community. For example, I'll give you two examples of drugs like spiramycin, which is used for treatment of Toxoplasma gondii, and desmopressin, which is used for treatment of diabetes insipidus. Now you can understand that Toxoplasma as well as diabetes insipidus, these are not prevalent diseases in the community. These are rare diseases or not so common diseases. So this drug that is used for these conditions, that is spiramycin or desmopressin, is not considered as an essential medicine. But on the other hand, you have a drug like atenolol. Atenolol is a drug that is used for a hypertension. Now, hypertension is very much prevalent in the community. So you know that the drug that is used for treating hypertension, like atenolol, is an essential medicine. Similarly, drugs for the treatment of tuberculosis. Tuberculosis is a disease which is very prevalent, especially in our country. So it is the drugs which are used for treating tuberculosis are included under essential medicine. So it should be based on the public health relevance. The next one is that the drug should be efficacious as well as safe. So, for example, you have got a drug that is pioglitazone. It is an anti-diabetic drug and it is very highly effective drug. But recently, we got reports of its adverse drug reactions. Okay, and because of that, pioglitazone is no more considered as an essential medicine because though it is efficacious, it is not very safe. So both efficacious as well as safe drugs can be considered as the essential medicine. Then the third thing is the comparative cost effectiveness, and this is mainly applicable when we have to choose a drug, choose one or more drugs for the from the same therapeutic category. So in this under this situation, we have to not only consider the unit price of the drug, we have to consider the total price of the treatment. I'll give you one example. For you have got the liquid formulation of anti-snake venom, and that is considered to be cheaper than the lyophilized form, but it is both are equally efficacious. Now, if we choose liquid formulation of anti-snake venom because it is cheaper, the problem with it is that it requires a cold chain for storage, which is sometimes difficult to maintain. So to have a cold storage, you will have to spend something else. So the total cost of the treatment will be more. If we had considered only the drug individually, we'll feel that liquid formulation of anti-snake venom is cheaper. But when we consider the total treatment, we can see that there is no much advantage of the liquid formulation because it will require a cold storage which will be having some additional expenses. So both liquid formulation of anti-snake venom as well as the lyophilized form are actually included under the considered as the essential medicine. One is included because it is cheaper and the other one is mainly because it is more advanced. Okay, so anytime we are choosing a drug, we have to consider the cost as well as the effectiveness of the comparison, means how much it is effective and how much it is costly. We have to draw a conclusion based on that and select it as the essential medicine. So three things we are to consider. Essential medicines should be should be having a health relevance to the majority of the population. They should be efficacious and safe, and they should be cost effective also. The next one, essential medicines are to be available within the healthcare system or at all the time. They should be available in adequate amounts, in appropriate dosage form, in assured quality, and at a price that is affordable to the individual as well as the community. These are the features about the essential medicine. So you have to define what an essential medicine is. You have to say on what basis they are selected, that is based on the public health relevance, the efficacy, safety, and the cost effectiveness, and they should be available within the health system at all times in adequate amounts, in appropriate dosage form, in assured quality, and at a price which the individual and the community can afford. So if you are asked to define an essential medicine or write a short note on essential medicine, you have to write these three areas, that is the definition of the essential medicine, the selection basis, and the other features. That is a requirement. Now we go to the essential medicine list. Now the list containing essential medicines is the essential medicine list, and the essential medicine list can be prepared at different levels. So as you can see here, there's a WHO list that is prepared by the WHO. Then you can have list of essential medicines being prepared by different countries. They are called as a national list of essential medicines, or the NLEM. Then you can have in a country itself, you can have different states which can prepare their own essential medicine list. And even at the state level, you can have different hospitals which are preparing their own essential medicine list. So they can have essential medicine lists at different levels of the healthcare system. Now we'll see the WHO EML first. So the first model list was produced by the WHO in 1977, and it included 220 drugs and vaccines. In 2002, WHO named the essential medicine drug list to the essential medicine list. Okay, initially they had called it as the essential drugs. You can see here the model list of essential drugs. Later on, they named it as the essential medicines. Instead of the drug, they used the term medicines. In 2007, the model essential list by the WHO was prepared for the pediatric age group. The current WHO EML is updated in 2015. It's the 19th edition of the WHO EML. It has got 414 medicines. So, and as compared to the 220 medicines with which the WHO list started, it is now having 414 medicines. Even the 5th edition of the pediatric EML has come up in 2015. So this is about the WHO EML. Now, what are the parts of a WHO EML? The WHO EML consists of the core list, and this core list consists of minimum number of drugs which are meant for basic healthcare system, and these include the most efficacious, safe and cost-effective medicines, and they are selected on the basis of the public health relevance. Then you have got a complementary list also in the WHO EML, and this list contains essential medicines for priority disease for which specialized diagnostic or monitoring facilities are needed, and sometimes the medicines may be effective but may not be necessarily affordable. Okay, that is the problem. Here the core list is the one that is catering to the basic healthcare system, whereas the complementary list of the WHO EML contains essential medicines for diseases, important diseases only, but the diseases those diseases require specialized diagnostic or monitoring facilities, that kind of priority diseases, the drugs which are used for those kind of priority diseases, the complementary list contains the drugs for them. So this is a core list and the complementary list. So you can see the WHO model list in 2013. It had the adult list and the pediatric list respectively. The adult list had a total of 374 medicines. In that, the core list contained 282 drugs and about 23 fixed dose combinations, and then the complementary list contains 68 drugs and the one fixed dose combination. Then similarly, you had the pediatric list with the total number and the core list and the complementary list respectively. Now, what is the main use of WHO EML? So it serves as a model list for countries. So based on this, the countries can also prepare their own list. So it's a model list for the different countries. And major agencies like the international agencies are there, like the UNICEF and the IDA. They are basing their catalog on the WHO model list. For example, the UN list of essential drugs for emergencies. It is based on the WHO EML, and this list contains about 85 drugs. It also, the standard compendia like the International Pharmacopoeia and the various reference standards like the WHO model formulary, then basic quality test, they are all basing their reference on the WHO EML. So it is mainly serving as a standard for all these countries, for all these organizations, and also for reference standards. Now we come to the national list of essential medicines. Now the different countries, they can have different EMLs. So this is because the priority healthcare needs of one country may differ from the other country. For example, tuberculosis is a prevalent disease in our country, but it may not be a prevalent disease in the West. So the drugs, the anti-TB drugs which are coming under an essential medicines in our country may not be essential medicines in a country where tuberculosis is not prevalent. So based on the prevalence or based on the priority healthcare needs of the different countries, they will have a difference of the list also. Now, at present, 156 countries have a national drug list of their own. We'll concentrate on our country, that is Indian NLEM. The first national essential drug list of India was prepared in 1996, and it had about 279 medicines. In 2003, it was revised as a national list of essential medicines. Instead of the drug terminology, the term medicine was used, and it contained 354 medicines. In 2011, the list had 348 medicines. That means some of the medicines were deleted from the list. The latest edition of NLEM, which was updated in 2015, has 376 medicines. That means 106 were added and 70 were deleted. Now the Indian NLEM, if you see the drugs are arranged in an order, and they will be having alphabets in brackets. The alphabets can be either P, S, or T. So if it is a P, that means it is available at the primary health care facility. S shows that it is available for secondary healthcare centers, and T refers that it is available at tertiary healthcare centers. So you will be seeing, when you see the Indian NLEM, you won't see a core list or a complementary list like the WHO EML, but instead you will be seeing all the drugs, and there will be brackets, the alphabets will be there, and these alphabets will be referring to the healthcare level at which these drugs are available. Now, further, the states and the institutional EMLs are also available. The first state which prepared an EML was Delhi government in 1994, and Kerala also prepared its latest EML in 2011 with 287 drugs. And there are different public health sector hospitals and advanced medical care institutes which have their own EML depending on their requirement and their public health relevance around the area where they are located. Now, the next one, this is the most important one, that is the criteria for selection of medicines into EML, which all medicines can be included under the EML. So the first one is that the adequate data on its clinical safety and efficacy should be available from the clinical study. So first one is clinical safety and efficacy should be established. The quality, the bioavailability, and the stability on storage should be assured. That means when you are storing it in the place, then these parameters should not change. That kind of drugs only you can use in a particular can be included under the essential medicine list. And the choice should depend on the pattern of prevalent diseases, which I already told you. If a disease is prevalent in a community, you should choose drugs which are catering to that particular disease. Then also the available of facilities, the trained personnel. So you cannot include a drug for which there is nobody who is trained to administer the drug. So you should have the drugs that are included in the essential medicine list should have facility for storage and facilities and for administration. There should be personnel who should be trained in administration of the drug. Also, there should be financial resources and it should also be based on the other genetic, demographical, and environmental factors. So all these parameters will be used for the selection of the essential medicines. Now, suppose there are two or more similar medicines. The choice will depend on the relative efficacy, relative safety, the relative quality, and the relative cost, and also the availability in that particular place. Then the choice can also depend on the comparative pharmacokinetic properties as well as the local facilities for manufacture and storage. So whichever drug which can be easily manufactured in and around the place will be preferred over a drug which we may have to import, or which we are not very much accessible to. That is the idea of the local facilities for management and manufacture and storage. Usually single compounds are selected as essential medicines. And when I was discussing about the WHO list, you would have seen that I mentioned about fixed dose combinations also. So usually the single compounds are preferred in essential medicine list, but fixed ratio drug combinations can also be chosen if they have an added advantage of therapeutic effect and safety, and there is a decreased chance of drug resistance by using them. This is mainly applicable to the drug combinations available for HIV, tuberculosis, and malaria. So these have got a special advantage of preventing the occurrence of resistance. So instead of using single compounds, even the fixed drug combinations are considered as essential medicines in such scenarios. Then the selection of EML should be a continuous process according to the changing medical and healthcare needs. So as you always know that there are new developments occurring, new drugs are coming. So based on that, and also as more diseases are emerging, for example, now suddenly the corona has now become a very important disease, which was not prevalent. Now in the coming days, you will have some vaccine which might be an essential coming as an essential medicine. medicine, we never know. So this essential medicine list is continuously evolving. It has to be continuously changed based on the diseases which are becoming prevalent, or which are taking the high priority, as well as the new drugs or new developments in the drugs, and the new drugs which are coming in the market. Now, and also the selection should be based on the rationally used clinical guidelines. This is the final say about the criteria for the selection of drugs as the essential medicines. So this I have taken from your reference text, Essentials of Medical Pharmacology by K.D. Tripathi, 8th edition. Now, what are the criteria for deletion of medicine from the EML? The first one is that the medicine has been banned because of some adverse drug reaction or any other factor. Then the other concerns on the safety profile of the medicine. So if we feel that there are many reports of the lack of safety, or there are reports of adverse drug reactions being reported out of proportion with the medicine, then it can be taken out of the essential medicine list. Now, if another medicine with better efficacy or favorable safety or better cost effectiveness is available, the other drug can be taken out and can be replaced by the better drug. The disease burden for which the medicine is indicated is no longer a national health concern. So, for example, now there are some diseases which are no longer there. Okay, at one point of time, it would have been a healthcare concern, but later on, it is not a healthcare concern. So, the drugs which were given for those medicines also they lose their position in the essential medicine list. Now, in case of antimicrobials, if resistance pattern has rendered a medicine ineffective. So, for example, there are antibiotics which were effective against a microbe initially, but with repeated use, the micro and the bacteria, they become resistant to that particular drug. So that drug is no longer may no longer be there in the essential medicine list. It can be replaced by another drug against which is actually effective against that particular microbe. Now, this is the thing that I've already said, that the list of essential medicines should be it's a dynamic document. That means it is continuously changing as per the disease, changing disease burden profile, the antimicrobial resistance, as well as the development of new medicines. Now, the advantages of the EML. So, the EML ensures improved availability of medicines to all sections of the society. So, since it is catering to the majority of the population, it makes sure that the majority of the population is getting the medicines. It also guides a safe and effective treatment of priority disease conditions of a population. It promotes the rational use of medicines. It optimizes the available health resources of a country. This is because we are now selecting medicines which are cost effective. So we are using the resources of the country in a proper way, instead of spending it on costly drugs which may not be having the effectiveness, or which may not be truly beneficial to the majority of the population. We are spending the resources on essential medicines which are catering to the majority of the population, as well as the ones which are safe, efficacious, and cost effective. It also simplifies the system of procurement, supply, distribution of medicines. So this means that now for any healthcare setup, if they have a list of essential medicines, it is easy for them to procure. Means they have the list, so they can easily procure them from the manufacturing company. Even their supply, distribution, everything is simple. They don't have to go on thinking about a new drug, or the list is always there ready with them, so they can easily procure them. The same list can be used for procuring, supply, and distribution of medicine. So finally, it increases the credibility of the healthcare system as a whole. And what is the weakness of EML? So the EML doesn't have many weaknesses, but one of the significant weaknesses is that it does not include the key drugs, certain key drugs which are actually crucial but may not be catering to the majority of the population. And these are the orphan drugs. So you know that orphan drugs are catering to the treatment of the rare disorders, rare diseases. Okay, and that is why these are not included in the essential medicine list. So that is one weakness of the EML. It is, though it is catering to the majority of the population, it is leaving out some population, or some rare diseases are not being catered by the EML. So we have completed the discussion on EML. So what you have to remember in this point, in this topic, is that it is more or less like a history topic. Like there's a lot of matter there, but the significant area that you have to remember for your examination point of view or for your UG level is the definition of essential medicines, which I think I've repeated I think 3 times at least during the discussion. So the definition of essential medicines and the criteria of inclusion of essential medicines in the essential medicine list, and the criteria for deletion. These are the 3 areas which you have to remember very significantly from this session. So I hope you'll write the notes and keep it ready. Okay, thank you.